Kristen is going to help us, and Susie Kilmer is going to first review her on live video.
So I've actually already done the toxin up in here, because give me a frown, Kristen, and wrinkle your nose up. And I always ask them to do that. She doesn't really pull down as much that way, but she definitely pulls laterally. So I've already put some toxin into there to relax that. A little tiny bit up here, raise your brows up, because this is a fairly deep crease right here. We've done her crow's feet because she just wanted to open her eyes up. But her main concern is around her mouth. And so what we're going to do here is give me a sad mouth, frown with the mouth. She's really strong here. She even recruits, do a really strong, you can see she's actually recruiting from her neck too. So we're going to do her neck, not only for Nefertiti, but also to help basically the depressors of the face or the neck muscles. We're going to try and knock them out to allow the elevators to win. Ball your chin up, and you can see she has a really strong chin here as well as that deep crease, so we'll put some toxin into there. And then lip lines as well, pucker your lips. Okay, yeah, go ahead and do a pucker. So even when she puckers, she recruits her chin. So we'll do all the toxin and relax. I'll do that afterwards. I'll start with the filler. And she cares a lot about these little lines in here. I'm going to use silk because I think Bellatero is just used there. The one thing I'd say about silk is if you put it into lips, you'll get a little bit more swelling. So now that we know to warn everybody about it, it's not really a big deal. We're not really going to do big lips. I'm actually probably going to do a little bit more Juvederm into your lips than the silk, because of the swelling. So we'll start with the silk. And, oh shoot, I forgot to open this one up. So here, sorry, forgot to open this one. And I'm also a needle bender. I like being able to keep it as horizontal to the surface as possible. So I think we probably have a similar amount of bend to our needle. And I'm just going to go around and I'm going to wipe off the numbing now so I can really see. And actually the numbing, one of the downsides to numbing is it does sort of fill things in. But I'm just going to go and kind of pop each of these little elevated, lines there and just kind of pop it up a little bit. You can see she's got one here. And I'm only going to do one side of her face so we can move to some other things. But you can see also the corners are down. I'm going to do that little K. You doing all right? I'm going to pop that up and put a little bit up into there. And she's got that line right there, so we'll just do just a teensy bit. And sometimes I think it's just even the subcision that we do with the needle that really helps. And then I'm always trying to move the skin and see, like, where will she crease. And this is really tiny amounts of filler. It's more just to pop it and maybe even break it open a little bit, like we said. So you sort of get the feel for that. She's got a good dimple here and here. And I'm going to actually use some of this there. Fill that in. And just by, filling that out, already it looks more youthful. I'm going to change over here to, what did I do with it? I just had it. Here we go. I had a Juvederm. Well,
while we're waiting, you can really see how her right oral commissure is lifted up so much more than her left. The happy on the right. So you can see with that small amount of product what a great job she did.
Yeah, and I've really barely used any of that syringe. I really have a hard time with the swelling with silk, so when I'm going into lips, I try and, I do use it, but I'm going to be using some Juvederm anyway, so now open up your mouth just a little bit. And one nice trick to decrease discomfort is I'll go in from the skin edge here, because she's a little bit jumpy. Go ahead, and I'm actually going up, and now I'm in the lip. I'm just going to give her a little ball of filler here. And I'm going to kind of go in and then up into there. Are you doing okay? She wasn't sure about this. And then I'm just going to take this and mold it up. And from that one little poke, I can kind of fill that side. And she really wants very minimal lips. I just want to give her a little lip show because, she's sort of folded in. I'm trying to pop it back out. And I'm going to do a little bit more actually to this commissure here. And then from there, I often will go just over to here and just give a little lift that way as well. So hopefully you can just see on that one side versus the other, and that's probably a total of 0.3. I don't even think it's 0.3 cc's. I've only used 0.1 of Juvederm, and you can kind of just see how that's popped it up a little bit more, and now open up a little bit. And you never want to make a sausage, so I'm always trying to make like a little pillow. I just want to get a little bit more into there. And then I'll grab that. And so now upper lip, just for comfort, I'll actually if I had my little ice packs, those really do help. But then I'm just going to go in and I kind of jiggle it, and then I get ready to like push right under ethmoid right as I do this. And then it's a little bit awkward in this position here, but it really decreases the discomfort. And I'm putting in a little ball there, and then I'm just going to milk it along. And you can really decrease your bruising and discomfort just by having the one area and then just sort of milk it to where you want it to go. Kind of what Noel was showing with the upper eyelids on here. I do my eyelids the exact same way that you do, Noel, where I put it in and I just sort of roll it where I need it to be, and that I think the side effects, the bruising and swelling, are much less. So the other thing she really doesn't have as much chin projection. So actually, I would like something stiffer in there. So I'll come back and do that with a different syringe. And then if you look right here, like sometimes you only want to do one syringe. So you're trying to make one thing do everything. So you can do, like go right into the sulcus along here. And it's not really depressed in here, but what you really see is up in here. But if I pop this right here and go in, and then I bring the needle up to there, and I just kind of fill it, and then I can kind of milk it that way. How you doing? Okay, and relax, and then just look at me for a second. And I'm just going to go up a little bit more. Now she's going to be a little bit numb there, and I'm going to do the same kind of thing and kind of put it into there. You can see like a little ball going there, and I'm going to just sort of milk it that way. And soon you're going to be able to see one side versus the other. And I'm going to do just a little bit more. You doing okay?
I can already see the improvement there.
And I'm going to show you, I've really not used very much product at all. So if you just look at one side versus the other, she looks really natural. I mean, I've done a total of probably 0.6 with everything that I've done. And I've really softened the lines. I've given a little bit more projection here, a little bit more in the lips. She looks very natural. I could definitely do a little bit more here, and I probably am going to go ahead and put some more in there, because you can see where she's sort of hollowed out right there. If I just decrease that shadow, it's going to be a lot nicer looking. If you want to bring her up, like a little bit of the voluma type lift up in here would be good, because she's sort of heavy down in here. We talked about she wishes we could kill some of this fat under here, but she does have more of this right in this area too. So you don't want to, like that, I have to be very careful about putting too much filler down here, or I'm really just going to square off everything. So I'm trying to figure out ways to add filler in here to lift it up so that I don't make her look too square. Does that make sense to everyone? Okay, I'm going to just do one. This should be pretty numb. I'm just going to go right up into there. You doing okay? I just gave that a second for that previous filler to kind of numb up, and then and you can see already the shadowing is a lot less. And, unfortunately, I don't have the option to have her come back in 2 weeks, but a lot of times I'll do that. Like, I don't want to do too much. I don't want to scare somebody the first time, and it's a lot of money, and so you can kind of inch things along. They've decided you're not an axe murderer, that you actually know a little bit what you're doing. You haven't turned them into looking like the bad Meg Ryan picture or, the other ones, and then they're more willing to proceed with other things. So I think, being cautious in the beginning is a good way to go. I just want to show you neck bands too, because I do a lot of necks, and I would say almost every patient I do that I've had regularly, I will do neck bands on. So now frown with your mouth again, and see how she really pulls out. And on this, extend your neck or like really grit your teeth. She's got a really strong neck band here, but hers is more over there. But I'll actually grab the band and then really fill it in, follow it down, and go ahead and relax. And try to get the whole band all the way down, like you can see it go all the way to here. And I'll do the same thing on that. Go ahead and make that, okay, like that's really strong, and you can really feel that muscle in there, and I'll grab it along. So I think it really helps to do that. I will tend to use, I think Dysport does spread a little bit more, so I like to use it in the neck more. And what else? Do you
have a total dose? Like, do you have a safe dose?
Yeah, I go up to 50 a lot. I mean, 25 is really a minimum, and anybody who, do you do yoga or Pilates or lift weights? Yeah, I mean, the people who have really strong muscles like this tend to do something that builds their core up, which is great for your core, not so cute for your neck. So and then I'll usually start with 25 though. 50 is pretty much my upper limit, but I do 50 in me routinely. So if I've done somebody for a while, then I might, increase up a little bit above that. But they have to have really the strong neck muscles to justify that. So as long as we're doing this, let's go ahead What else? Oh, the other thing is I was really taught, like I started Botox way back when Botox first came out, for cosmetic use, and when Gene and Alistair were starting it, and it was always really important to hold this area here so that the fluid didn't go down, get into the septum. And sometimes when I inject, I'll actually feel that fluid pushing against my fingers. So I think that's really a important way to prevent lid ptosis. And what else did I want to say? Really go lightly up here, and like she has a little bit of a shadow here that isn't quite as prominent on that side. Maybe it's because I'm standing here. I might round that just a teensy bit, but not too much. Any other comments, Noel, that you would say?
I was just going to say one thing. I know with ptosis in the previous lecture they were talking about iopidine, but very inexpensive. You can buy over-the-counter, at least in Canada. I'm pretty sure you can buy it in the States. It's called Naphcon A, Naphcona, and it works just as well, inexpensive, OTC, so you can just keep it in your office instead of buying the prescription.
That's what we do too, actually, at our office.